Now, this was a study that actually was done on children and teens after they had COVID and recovered, and the mean age was 11 years old. And here we can see the comparison of the three groups on the top row. We have healthy lungs, the people that were never infected. Then you have the recovered lung, and then long COVID lung. And remember, these are for children and teens even who should have like fantastic lung function. In the first column, I should say, it's not like they were on a ventilator, it was that they were breathing gas exchange. Then in the second column you see perfusion, that is blood flow. The third column you can see the combination of gas exchange and blood flow. So with the ventilation, you can see there are marked differences between healthy lungs and long COVID lungs. And again, these are children. But even those that are recovered, that think that they're, fine, feel fine, or they report they feel fine, do show some damage occurring. And same goes when you look at perfusion levels. Never infected at the top compared to lungs for children that had recovered, essentially, versus long COVID. So altogether, we can see that that's a pretty vast difference. Important to note is none of the COVID-19 group required hospital admission during the primary infection period, but they had exhibited shortness of breath, impaired attention, headache, fatigue, loss of smell were the most commonly reported symptoms at the time of the study. Results from COVID-19 group were compared with those from 9 healthy controls. Another study found that there was evidence of viral presence in the lung up to 359 days after the acute phase of the disease, so after initial infection. Additionally, there was significantly elevated levels of T cells, which are immune cells, in the small airways of the long COVID patients than their interstitium of the lungs. And the interstitium is really the space in between the alveoli, and those alveoli are those little balls that you kind of see there that create surface area for more oxygen exchange. When you look at this study that showed the mild COVID causing significant organ damage in babies of infected moms, like while they were pregnant, mild COVID found to have significant effects on fetal lung growth, with reduced lung volumes observed in babies born to mothers who had mild COVID, the study showed. Interestingly, another study had showed that lung damage from SARS-CoV-2 could contribute to the severity of an influenza infection, which wasn't the first time we saw that. We initially saw it reported in 2021, where co-infection with influenza A virus enhances SARS-CoV-2's infectivity. Now, this was the current updates from the CDC website that the most frequently reported influenza virus, really so far this season, this week, were the influenza A H1N1 PDM09. But that study, again, what I found so interesting was that influenza A pre-infection significantly promoted the infectivity of SARS-CoV-2 in a broad range of cell types, remarkably in vivo. So that would be like in live cells, not like test tube, but remarkably in vivo, increased SARS-CoV-2 viral load and more severe lung damage were observed in mice co-infected with influenza A. But this was not seen with other viruses. So it ultimately showed that influenza A had a unique ability to aggravate SARS-CoV-2 infection, and thus prevention of that type of infection. Influenza A could help with outcomes for SARS-CoV-2 infections. And ultimately, I wonder if that could be another reason why we are seeing just the surge that we are seeing. I know here in the Southeast region, we are seeing the flu season was first. So I wonder how that's going to play a role in now that we have COVID-19 cases climbing. I'm concerned about the implications, if that's going to play out again. Obviously, different variants have different effects, and so we'll see. That's, yet to be seen. But yeah, ultimately, it is extremely common. You're not alone with that, and the fact that you are able to at least see, or you've identified the lung damage is a good thing. How many people do we know that keep saying, oh, their infection was mild, it was just fine? They have no idea why, they're coughing a little bit more, they get winded a little bit more easily. All these people that have kind of changed their baseline, where maybe they used to run marathons and now they're still running, but just haven't done marathons and they blamed it on everything else, are, denying the fact that they have long COVID. Thanks for listening for